Kate Scarlatta, and I'm the owner of For a Digestive Peace of Mind, a nutrition consultation practice in Medway, Massachusetts.
Hello everyone, I'm Tony Fiore. I am also a registered dietitian that works at For a Digestive Peace of Mind.
So today we're going to talk about a topic that really affects a lot of people, whether you have IBS or not, and that is bloating. It's a common concern amongst IBS patients, those with irritable bowel syndrome. And what I wanted to do is talk a little bit about what bloating is in contrast to what abdominal distension is, because they are distinct, different terms. So bloating is that sensation of feeling that your body's expanded or your intestine is stretched. It's a sensation that you experience. Well, abdominal distension is actually the growth in your abdominal cavity. So if we see a lot of patients and they'll say, at the end of the day, I feel like I'm 9 months pregnant, and they may actually look 9 months pregnant, maybe not 9 months, but 3 months or 4 months. I experienced actually abdominal distension when I had small intestinal bacterial overgrowth, which we'll talk about. And that's just this growing abdomen that's clearly stretched and enlarged. That's abdominal distension. Bloating is the sensation. And what we were going to talk about is, why do IBS patients experience bloating, the sensation of fullness? And that has a lot to do with visceral hypersensitivity. So Tony was going to talk to you a little bit about that.
Yes, so a little bit of science for you guys, but we have this vagus nerve that runs from our brain to our gut, and oftentimes people with IBS have this disconnection, would you call it, where they're feeling more of a sensitivity. They're feeling bloated, where in actuality they are not distended, which is what Kate was talking about. So it's more of a sensitive feeling of the bloat as opposed to the objective distension.
Exactly. Just think of it as having a sensitive gut. You're more sensitive to certain triggers within the intestinal wall. You feel them greater. Someone might have a big bowl of chili and have a little gas. There's no pain, there's no sensation of bloating, but an individual with IBS could have that same bowl of chili and have a lot of pain and cramping and a sensation of fullness. So there's a different feeling altogether that's registering between their brain and their gut. And so what we wanted to talk about was to define those differences, and then to talk a little bit about why this occurs and what are some other things to consider if you have irritable bowel syndrome and experience a lot of this bloating sensation. And if you don't have irritable bowel syndrome and you're experiencing bloating, some things that you may want to talk to your health professional about. So I think the first thing to me that comes to mind, and we see a lot in our practice, is small intestinal bacterial overgrowth. So one of the real tenets of small intestinal bacterial overgrowth is bloating, and also abdominal distension. So those are two things that kind of come in hand in hand with small intestinal bacterial overgrowth.
Or SIBO, you might hear it. Sometimes we'll use those terms interchangeably.
Absolutely. And so with small intestinal bacterial overgrowth, this is a condition where you have abnormal amounts of bacteria in the small intestine that don't really belong there. And so they're capable of fermenting foods, breaking down foods before they even have the opportunity to be digested. The bacteria are waiting in the wings, and they'll get to them and create gas, which can stretch that small intestine and lead to that bloating sensation. Treatment for small intestinal bacterial overgrowth,
it varies. What most physicians, I would say, are going with is rifaximin or Xifaxan, and that has the most research right now for SIBO, and it's more, I guess it's considered more safe, would you say, because it targets specifically the small bowel as opposed to the entire GI tract or widespread.
Absolutely, and it's not absorbable, so it's not going to get through into your bloodstream systemically, and that's also a safety extra for rifaximin.
And we find that it works. So a large population of our patients do have small intestinal bacterial overgrowth, and if it's the right patient, it's pretty successful, I would say.
Absolutely. So in addition to small intestinal bacterial overgrowth, other reasons someone may experience bloating may be gastroparesis. And gastroparesis is basically a delayed stomach emptying. And so if your stomach's expanding and not really emptying the foods into the small intestine, you can have some upper abdominal sensations of bloating. The other conditions we were going to talk about, in addition to small intestinal bacterial overgrowth and gastroparesis, is also just general motility disorders. And motility disorders can arrive at a number of reasons. People with diabetes have nerve damage that can affect motility, patients with Parkinson's disease as well. But IBS is also a motility disorder, so that can contribute as well. Did you want to comment a little bit about motility disorders and maybe what we see is around constipation?
Yes, and I was thinking of a lot of people when they come in, so we'll have to circle back to constipation, is foodborne illness. So oftentimes where people come in and they're saying like, gee, a couple years ago I had this foodborne illness when I was traveling, and that's when the perfect storm arose.
Absolutely.
So what we're seeing here is there is a partial paralysis in the gut. Would you like to expand on that? The testing that is out right now?
So there is Mark Pimentel's group at Cedars-Sinai has worked with Commonwealth Labs in developing a test called IBS Chek. This looks for certain antibodies that are associated with small bowel paralysis due to a post-infectious foodborne illness event. So if you have experienced a severe bout of foodborne illness that you can recall, and that was sort of the beginning or the start of your bloating symptoms, it might be worthwhile to talk to your doctor about checking for these antibodies with IBS Chek, and then also just bringing that up as part of your history, because that might, really be important. And as Tony mentioned, it can lead to that small bowel paralysis, partial small bowel paralysis.
Had to mention that.
Yeah, definitely.
But I think constipation is a huge piece of this too. If you're not moving your bowels, things are sitting in there, and there's going to be more opportunity for fermentation and gas production, and just the feeling of bloating, but also distension.
Absolutely, and that's probably a big underlying issue as well. And sometimes our patients will come in and really, they don't think constipation is part of their picture. They go to the bathroom every day, but if they're not having a really good cleansing bowel movement, they still can have bloating as a side effect. We also see other conditions associated with constipation. We're really getting heavy in this talk today.
You can't put us together.
Exactly. But what we do see is what's called Nergic Defecation. And this is when individuals, when they are going to the bathroom, their anal sphincter actually contracts instead of relaxes. And so they don't have good release of stool, and so they're accumulating stool in their bowel, and that does contribute to bloating as well. There are tests for this. One test is called an anal manometry, and there's treatments for it as well, and that involves physical therapy and biofeedback. That's very effective. So, there are ways to counteract bloating and to really help you correct the situation and correct the abdominal distension if that's part of your sort of symptom picture.
Well, I just want to interject here. It's funny because we talk about this all day long, and we see people who have suffered for so long with these symptoms that sometimes are like, oh, it's just IBS. And when we bring up these tests, they're like, you want me to do what? An anal what? A manometry? But what we find is when they finally educate themselves, or we help them understand what these testings are and aim to do, it makes their quality of life so much better. So don't be frightened by our terms. I think it really can make a difference if some of this information is sounding familiar to you.
Absolutely. And then of course the low FODMAP diet can help with bloating as well. It has really solid research looking at reducing the sensation of bloating, abdominal pain, and really can be effective for 3 out of 4 people with IBS. So as bloating is definitely probably the most difficult symptom in many ways for patients to experience. Trying the low FODMAP diet we see in the research also suggests and shows is really quite helpful. So for the last part of our section today, our little video, we're going to talk a little bit about some supplements that might help. And of course, when you are thinking about adding supplements to sort of your daily regimen, always work with your healthcare provider. There's interactions, even if they're herbal supplements, you never know if that's going to interact with something that you're already taking. So I'll move it over to Tony to talk a little bit about some of the supplements and that we sometimes use in practice.
Thank you. So our favorite one I got to start with, IBS gas. This is, I believe it's from Australia, was it?
No, it's actually from Germany.
Oh, just kidding. So in Germany, but we use it all the time. And I also especially like, it's safe with kids for the most part because they have dosing for children. So what it is an herbal cocktail, a combination of different herbs that act to, as a prokinetic, so they keep things moving along, which can help with both bloating and constipation, as we've discussed. And peppermint extract is in it as well, which can help calm things down a little bit.
Yeah, relaxes the muscles of the intestine, which is helpful and has really good evidence. So we do use a fair amount of iberogast. I would say, you know, some patients are like, this is the best thing they ever had. And then other patients, moderate effects. It acts almost in a spasmodic effect in the gut. So for some people that can aggravate symptoms. And then for really, I would say the majority of our patients, it really does help a lot. There's also some interesting research looking at artichoke leaf extract, and we use that sometimes too. And the brand that seems to work for our patients, and you know, again, I'm just throwing this out there because sometimes it's good to know a brand that works, is the Solaray artichoke leaf extract, and patients just take it as described on the bottle. So we've got artichoke and iberogast.
And did you mention the artichoke? We were recently looking at a paper that it's shown in the research. So we always try to back up what we're saying with what's actually working when they're doing studies.
Absolutely. Both iberogast and artichoke leaf extract have numerous studies you can look up in the medical literature. So yeah, again, we're sticking with evidence-based medicine here. And
as nutritionists, it's always nice or dietitians, when the supplements we're offering or recommending are natural. They're natural herbs.
Yeah, exactly.
So it's always a perk.
Yeah, absolutely. And so the other, sometimes what can help for patients is just getting enough fiber in their diet. And I would say it goes both ways. Sometimes fiber can aggravate symptoms, and sometimes fiber can be helpful. Of all the fibers we've really explored in our here in our practice, we often use consol, which is a psyllium husk, titrating it up very slowly. And psyllium husk can soften stool and also kind of help with elimination. Doesn't work for everyone, but again, that can be on our to-do list for patients that are suffering with constipation, as well as other things such as adequate water and exercise. That can be helpful as well. And then lastly, again, we're not doctors, but we like to bring up that there is pharmaceuticals as well that can help with just the motility of your intestine, and that can ultimately help with bloating symptoms. So you want to comment about some of the drugs that we see docs recommending?
Yes, so we have a few that we see our patients on, but again, the doctor will be prescribing them. Oftentimes, Linzess is used. Would you see that in our patients? I often see the first line of defense is the Miralax, the pulling of the water into the intestines, laxatives, and then Linzess works a little bit different. It does pull some water in, but it helps with the motility and getting things moving along.
Exactly.
Resolor as well. This one, I'll let you take this one.
So Resolor is actually not available in the U.S., but I know that there are some medical groups around the country and gastroenterologists that use Resolor when constipation is really kind of a bigger problem. So you can access that through a Canadian pharmacy, and some of our patients do that. And lastly, Amitiza, which has been around a little bit longer, and that has pulls in some water and does help as well with constipation in some patients. So there are some pharmaceutical medications. Certainly we like to try the diet first, just some subtle nutritional changes. Have the patient, ideally worked up for small intestinal bacterial overgrowth if we suspect that's part of the picture. And putting everything together. If constipation's a problem, getting that corrected with physical therapy and biofeedback and, some adjunctive nutritional changes really can be helpful. That's really all I had today on bloating. Any other comments?
No, I think looking back on our convo, there are quite a few pieces to this. So just, something to think about. And
Absolutely. Yeah, and work with your health professional. Don't self-diagnose, don't add supplements to your repertoire, don't change your diet just on your own. Work with a registered dietitian that specializes in digestive health and with a gastroenterologist to just make sure we're not missing anything that would be, need more treatments, and that you're under good guidance and not doing this alone. So thanks for listening.
Hi, guys.